Cannabis therapy associated with quality of life improvements in chronically ill patients. A recent survey captured 1,582 reported outcomes from patients using medical cannabis in Germany. The authors used a matrix of symptoms to track quality of life. Patients reported on chronic pain, sleep disturbances, stress, tension, inner restlessness, depressive mood, muscle tension, and others. 84% of those surveyed reported improvements following the use of cannabis. Cannabis therapy may improve the quality of life of patients regardless of the disease, the study authors concluded. These findings are consistent with other observational studies from Australia and United Kingdom. Traditional studies try to identify a diagnosis and seek to demonstrate changes in the diagnosis. The process is reductionist. Patients with multiple symptoms are often excluded from studies. The idea is to identify one compound that improves one diagnosis. This magic bullet approach is ideal for patents and profits. However, people are not that simple. Assessing a matrix of symptoms plays a special role in cannabis-related therapy. Multiple active ingredients and multiple molecular targets create a broad range of effects that are typically associated with cannabis. Although this approach may be difficult to patent, it addresses the real-world experience of patients. In that light, a matrix of quality of life measurements should be the standard for all therapeutic approaches. As well, assessing a symptom matrix could contribute to the identification of multiple diseases and the better treatment monitoring. Cannabis was legalized by prescription use in Germany in 2017. However, cannabis products were typically only authorized when patients were unresponsive to traditional therapies. Beginning April 1st, 2024, the personal possession of cannabis will be legal for adults over 18. The German parliament also voted to declassify cannabis as a narcotic, ease prescription requirements, and make patient access easier. Now in Germany, it will be legal to possess 25 grams of cannabis in public and 50 grams in private, and have up to 3 cannabis plants at home. Nonprofit cannabis social clubs are also due to be legalized on July 1st, 2024. However, direct sales will not be permitted. The market model reminds me of California's Prop 215 days, when patient collectives were intended to charge service fees rather than directly charge for the cannabis. It's now proven that 84% of chronically ill Germans will improve their quality of life using cannabis. The study may contradict the finding that 30% of cannabis users have a substance use disorder. Cannabis is different. It doesn't fit into traditional pharmaceutical models. It's a multi-agent product that generally improves quality of life rather than a single-agent product that targets one disease. It's easily grown in your backyard and can be shared with your neighbors. Along those lines, it doesn't easily fit into Babylon's market models. These new laws make Germany the largest federally legal recreational and medicinal nonprofit cannabis market in the world. I propose we follow suit in the US and revert back to the nonprofit model. What do you think? This is Dr. Jean Talleyrand with Hyatt 9 News.
I agree with your last statement, Dr. T.
You want to go back to nonprofit?
Well, I mean, nonprofit was all profit back then.
Yes, it was.
You know, and so that's how I see it. Nonprofit was all profit back then. Now we're having to split all of our money with the government, and the government's taxing us at crazy, erroneous rates, and now there is no profit.
Nonprofit, you can write stuff off, right?
Only profit you can find is on store shelves if you're going to purchase the Profit brand. Just saying.
Shout out to Profit brand.
Mm-hmm.
Shout out to Good Flower coming out, coming out of Northern California. Shout out to Luke Scarmazzo, Mandy Tingler. Shout out Profit. Shout out.
And shout out to Ali Muffins over here, Mr. Pharmacist, saying that this is his American profile. This pharmacist who gave us a super chat, saying, "Oh man, you guys, where did it go? That's right. The Women's Canna Awards, there's a discount code of capital W, Woman Rule 30. Capital W, Woman Rule 30 is the discount code for your
discount
tickets.
Code.
Yes, your discount code for the Women's Cannabis Awards getting held here in L.A. March 30th.
Yeah, support the women. Support the women in cannabis. Come out, see some great people. There's I think there's 60 brands, 50 retailers going to be there and representing. And yours truly will be there with my better half, celebrating my women in my life.
Amazing.
Do the same.
So,
do the same.
Dr. T, back on your story, Dr. T. I have a question in regards to this. I mean, a lot of this is basically just confirming a lot of anecdotal evidence that we, as cannabis consumers, have known for years that we have a higher quality of life than everybody.
Yeah, but the opposition keeps trying to prove that we don't. 30% of us are addicted, and addiction as measured is problematic. The use is problematic rather than improving your quality of life. So that's some of the propaganda that's being proposed in other places. But yeah, Germany's doing it the right way here, and just pointing to the obvious. 84% of people who are using cannabis with chronic illness have a better life.
Of course they were. Of course the cannabis improved their life. It gave them something else to think about instead of having to focus on all that pain they're constantly just getting slammed with every time, every move, every whatever, every motion. Dr. Mark, you have any thoughts on this, Dr. Mark?
Well, some people claim, especially older folks, that they don't want to feel the paranoia that often is associated with a cannabis high. But I'll contend that the thing that makes people paranoid are the laws. It's the laws that make people, maybe
That's a great
think
point.
underneath their thinking is that I'm breaking the law. I'm going to get in trouble. So this is kind of like, again, part of the reason why I think we live with this stigma is that we're all kind of outlaws in the eyes of the government. And I guess doctors like Jean who, prescribe cannabis are kind of out of the norm of, doctors that are drones of the pharmaceutical industry that basically just carry out the delivery of FDA approved drugs. Right. And it's like, I've said it before on High at Nine. I think if, cannabis is not a drug, it's a medicinal herb. And whenever a medicinal herb can provide relief to some kind of medical condition or illness, I think doctors ought to have that as an option before prescribing FDA approved drugs. Right? Because that, you can probably give them an FDA approved drug, but why not try cannabis first? Because most likely cannabis isn't going to create an addict and it's not going to kill them. But, we've had this discussion with Dr. Talleyrand before. I mean, what does the rest of the medical community really need to see in terms of efficacy and safety data? So that doctor that's about to write a prescription for an FDA approved drug, he says, you know what, maybe you should go to your local dispensary and get a sativa or get, give him a recommendation around using cannabis. I don't know, Jean, what do you think? I mean, what do doctors really need to see to get them to maybe not prescribe an opiate, but to say, hey, try a cannabis concentrate or a cannabis?
Well, we're trained for single agent treatment, right? We're trained. They would need to be retrained. It's a long road. They would need to understand how to advise on plant use. And by the way, for those who are getting paranoid with cannabis, it's usually because you're using the wrong product at the wrong dosage. It's just misusing. You can have adverse effects with any product if you misuse it. So, switch what you're doing. Put more CBD in what you're using.
Fair enough. And on that, we're going to go to a commercial, and we are going to be right back because, Dr. T, we're going to have more on these topics coming up in a future story today.